Hello everyone, welcome to another educational video. Today's presentation highlights some of the quality improvement activities or projects that trainees undertake in primary care. The goal of this activity in the vocational training scheme is to instill the principles of improvement science and leadership. Leading your practice in a change process is not easy. You may feel a lack of power to lead change or uncertainty around what quality improvement activity should look like. I hope these examples can give you an idea to kickstart your examination of the system where you work, the curiosity to probe and reflect on whether this or that could be done quicker, differently, or otherwise. Pick a goal, set up measures of progress, iterate your activities using the PDSA cycle, and present your findings to the practice. Meet T. He conducted thorough research to identify all the local support services available. A comprehensive list from mental health hotlines to domestic violence shelters and carer support groups to youth centers. Then organized all the information into a single, user-friendly document categorized for easy navigation and saved on the practice intranet. This document includes phone numbers, email addresses, and websites for each service, making it easier to connect patients with the help they need. To ensure this resource was truly impactful, he conducted an audit before and after its launch. The results were clear. More and more GPs were using these services, and their awareness of available options significantly increased. By making support services accessible, the practice can build a stronger, more resilient community where vulnerable patients feel supported. Meet M. He created an automated command on EMIS for opioid-naive patients to be issued just-in-case medications and issued a ready-to-print prescribing and authorization sheet that is easily customizable to the local prescribing protocol or for an individualized regimen. This reduced the turnaround time for completing these charts. What's the result? All these activities were done in less than 3 minutes compared to 15 to 20 minutes if completing the same task manually. Another time-saving improvement was updating the shared care guideline for DMARDs, methotrexate, leflunomide, etc. in the form of algorithms so clinicians can act on it easily if the blood test results are abnormal, including sending automated tasks to the receptionist or patient recalls team. Meet Z. She looked at the control of type 2 diabetes in over 80-year-olds. About 100 patients with HbA1c of 48 or less had their medications reviewed. The guidance in this age group recommends de-prescribing medications, especially in the frail subset of patients. She stopped or reduced the medication and arranged a follow-up at 3 months to see who needed to go back on medication. She also designed self-vaginal swab leaflets to give to patients who needed swab samples taken, as evidence shows that self-taken swabs are just as good, if not better, than a clinician taking them. Meet O. The Joy in Work project aimed to identify areas of staff well-being that can be improved without additional investment in premises or staff. The project deployed IT solutions that collected staff feedback and analyzed this daily for joint solutions. He also improved staff processing of FitNote requests. The changes in guidelines required a change in practice SOP for processing requests to reduce administrative load and help the practice focus on the COVID-19 vaccination program. Meet S. Some project ideas may come from significant events to improve clinical practice. He developed the practice algorithm for glucose monitoring to prevent steroid-induced hyperglycemia. He also conducted a quality improvement activity on the newly introduced Q-Risk-3 score and the patient education that goes along with it. Meet E. He engaged in a quality improvement initiative that monitored the frequency of measurement for uric acid levels in patients without chronic conditions who were prescribed urate-lowering therapy for gout, going back 2 years and checking how practice aligned with guidelines. Additionally, he actively engaged in medication reconciliation using the RCGP toolkit as a valuable resource in this process. So, her project was aimed at improving annual reviews for patients growing up with learning disability. The practice is required to maintain a register of patients with learning disabilities. For some with a learning disability, primary care may be their only contact with healthcare services, and so the only opportunity to support and maintain their health and well-being. Meet A, the last but not the least example, features a few activities. QIP to improve patients' uptake and use of the self-check BP machine at the surgery. QIA to study how quickly patients receive their acute meds when they are at the emergency department. An audit of celiac disease diagnoses in the surgery in the last 5 years, which explored whether people with a diagnosis of celiac disease received their diagnosis following a specialist referral. Finally, an audit to check practice adherence to the 3-month state-in review recommended for patients on atorvastatin for primary prevention of cardiovascular disease. For further reading, check out our ebook. This is a great read for anyone interested in quality improvement. It is concise, straight to the point, and teaches you all the fundamentals you need to know about quality improvement in primary care.